Welcome to this brief video on setting your PIN and the ER tracker. If this is your first time logging into Meditech, please find the Meditech Live icon on your desktop. Double-click and log in using your username and password that was provided to you. If this is your first time logging in, it will prompt you to change your password. Once in, please come down to Order Entry, change your password PIN, and change your ES PIN. In here, you'll be prompted to enter in your password that you just created, verifying that it's you. Enter in at least 4 digits, and then re-verify, entering those same 4 digits. And this is to set your PIN that you'll be using to sign off orders and documents. Once you have done that, please come back to your main applications and click on EDM. Then click on Private Tracker. This is going to bring you in to the current tracker board, and you can see what patients are in the ER. Okay, so this is the current tracker. You can see the current patients that are in the ER. If we were to click on these up here, you would be able to see different information on your patients. If we were to click on the clinical tracker, we would actually be able to see the patient's full name. But for privacy reasons, I'm going to leave it here with the initials. So I'm not going to click on those, but you may pick your preference. Also, as you can see that this patient right here, this patient KB, is highlighted. So up here in the header, which you cannot see all of the information on this, is her full name, her height, her weight, her age and her birth date, allergy information. So depending on what patient you have highlighted, if I was to come down here and click on patient BM, we would be able to see her information up in the header. Again, this patient right here, since she is highlighted, will correspond with this information right here in the yellow. So these boxes correspond with this. We can see she is in room 1. There is no priority level assigned to this one yet. I'm sure they'll be doing that shortly. We would be able to see physician. Currently this says ZZ because she has not been seen by a physician yet. It'll default to ZZ. This patient down here we can see has a physician with the initials of MC, the nurse ASM, and so forth. So the information up here corresponds to the boxes below. If we were to come over here to the right-hand side, interventions, this will take you into nursing interventions. As a provider, you will very rarely ever be entering the interventions. But this is where nursing will document past medical history, stroke interventions, any interventions that they need to document on the patient. Reception, as a provider, again, you will very rarely use this. This will be what the ward clerks and nurses will receive the patients. Allergies and medications, you could possibly be using this tab, but in here we'd be able to see the allergies that the patient has. If we were to come over here to medications, there are currently no medications on this patient. If this patient had had any prescriptions filled, down here under the payer drug history, we would be able to see the external med history. Now for controlled substances, you still have to use your outside drug monitoring program, so you can do that right from here. Do you see how I did that? I just clicked on the globe. You'd be able to click right here on the PA drug monitoring program. It'll open up the browser directly to it. You will have to log in using your username and password, but then you would be able to search in there. Room staff, if you were to click on room staff, you'd be able to see the full name of the nurse and the full name of the physician that has signed up for that patient. Sign up, again, we'll sign you up as the care provider. EMAR, in here, this is where nursing will sign off on their medication orders. Notes, this will be where nursing will enter notes on the patient. We can see this patient only has one note that's been entered so far. We can see the time, what nurse entered it, and then down here you see the full note. Orders, I will take that, I'll show you this in a different video, how to do the orders. Order list, these are the orders that have been ordered on the patient. You can see what they are, their category, who ordered them, and so forth. Reconcile meds, this is where nursing will go in and reconcile the home meds. If you wanted to, you could click in here to view the information. Advanced status, if we go back to the tracker, this will be the status down here. It'll advance your status from received, triage to received, to departed, whatever their status is. Nursing mostly does that. EMR, I am going to show you this in a different screen, but this will open up the EMR. Admit request, this is very rarely used. Patient summary report, you could click on, it will open up a compiled summary report of your patient if you were interested in that. Providers do not use that, mostly nursing does. Depart, this is where you will do your depart for your patient. Sign, if you had any orders that you needed to sign off, they would be in here. You could click on this and sign your orders. And document, this is where you will enter in your document on your patients. So this concludes the brief overview of the ER tracker. Thank you.